Hey, it's Lori, and this video is going to be all about health update stuff. All the stuff that's going on. I've got some appointments coming up. I've got one right now. I'm about 30 minutes early. I'm at the hospital right now, and I have to go in for an ultrasound here, and I have no idea where I'm going, so that's why I'm so early. And also, there's another reason too, I'll tell you in a minute, but oh my gosh, it's not funny at all, but I have to laugh because otherwise, goodness, it could be bad. They said just to come to the main entrance and go in and ask for the radiation department because that's where my test is going to be. I'm having an ultrasound because if you're a guy and you don't want to hear about girl stuff, well, this might not be the video for you. Let's just say that. But we're going to cover a lot of things. So we're going to cover a little bit about the GLP-1 stuff that I'm going to be doing and probably go into the results of today's test. So stick around if you want to hear about all that. But if you don't want to hear about the girl stuff, well, yeah, you know. But this is what I have going on right now. This is what's going on. And part of the reason I'm here so early is because before this test, I had to drink 32 ounces of water and don't go to the bathroom afterwards. I have to have a full bladder. And let me tell you right now, it's full. It is very full. And I hope I don't cough because it could be bad. Oh, God forbid I sneeze. Oh, my goodness. Please no. Anyway, yeah. So I'm thinking, okay, walking is not going to help that matter at all. So I need to get here early. I got to get in there. It's a little bit of a walk to get to the front doors, figure out where I need to go inside. I don't know how long of a walk that's going to be. And hopefully I can just sit still somewhere and, I don't know, concentrate on something other than the fact that I really got to pee right now. I really do. I hope they have a bathroom like right there after that test is over. I really hope they do. Okay, so I'm going to get in there, and like I said, this is all going to be about all the health stuff. So thanks for tuning in, and I will see you in a bit. I'm done with the test. I can honestly say I have never, ever had to pee so bad in my life. Oh my gosh. I had to go to registration first, and I'm thinking, oh my gosh, how long is this going to take for the registration part? But then I had to wait on them to call me back for the test. And during that time, it was like 10 minutes. And I was already to the point where I was kind of like, oh my goodness, I don't know if I can do this. Like, I literally did not know if I could hold it. Really. And there was a bathroom right behind me. It's like, that is so mean. And people going in and out, and I'm like, well, I hope you feel better, you know? I mean, jeez. But anyway, the lady finally came out to get me, and oh my gosh, I could barely get up out of the chair. And when I did, I was walking like Mrs. Wiggins from the Carol Burnett show. I just walked back with her, and I said, I'm really sorry, but I said, I hope this doesn't take very long, because I said, I don't know how much longer I can hold it. And she says, I understand so much. She's like, it's okay. And she says, I'm the one that's doing it. And she says, I'm really good at it. I'm the fastest there is, she said. She had an accent of some kind. I'm not sure what her accent was. Almost sounded Russian, to be honest. But I like her accent. It was pretty cool. I liked it. So anyway, yeah, so she did the test, and she's doing the ultrasound. And, you know, the last time I had an ultrasound, there was a baby in there to look at. So it was kind of exciting. It wasn't as exciting at all this time. But anyway, oh my gosh, she was doing the ultrasound, and she's like, I will try not to push down. I'll try not to push down. I'm like, oh, thank you. Thank you so much. And I was like, literally like grabbing onto the bar thing that was on the side of it was like a little table type thing with the bars that come up like a hospital bed has. And I was literally like squeezing that thing like, oh my gosh. I said, I am so sorry. I know I sound absolutely ridiculous right now. And she's like, no, it's okay. Oh my gosh. I know I did though. Okay, well, there's that story. So I don't have any results, but she said that so the reason for this in the first place is because I had the bleeding for like 5 weeks, right? So, and I honestly don't remember if I mentioned that in the beginning of the video or not, but that's the reason for this. And she said that she's not allowed to discuss what she sees with me, which that's, you know, I knew that's fine. But anyway, she said the doctor will be giving the doctor will be giving you your results. We're going to send it to him. She said, but I will tell you that I can see the reason for your bleeding. And I don't think it's going to be too terribly bad. So there's that. We'll see. Okay, well, that's all I got for you for now, but stick around. There will be more, including results. Here's the second installment of this health update. So it is a different day. It's 2 days later, and I'm at the doctor's office right now. I just got here. I went to Costco, if you can see that, but that's a different video. It's probably already up. And I'm going to go in and have him, well, his nurse, it's actually just an appointment with his nurse because they want me to come in for the first time that I mix my GLP-1. I have a cooler bag here. It's just a little lunch bag, and inside of it I do have an ice pack in there. It's still frozen, so that's good. And I have the vial of tirzepatide, the vial of my GLP-1, which is freeze dried, so it needs to be reconstituted, which is so much like, I mean, it's just like the HCG that I used to do, that I'm super confident that I can mix this myself. Oh no, where's my backwater? There it is. I have bacteriostatic water right here, and that's what I'm going to use to reconstitute it with. This is a sterile water, and I even brought my own alcohol wipes. I brought my syringes right here, and I just grabbed the package. I opened it because I wanted to see what they look like, to make sure it was 100 units, and it is. So anyway, that's all I wanted to know. That's the only reason I opened them ahead of time. But anyway, that is what I have with me, and I'm just going to pull this bag out and take it in. Whoops. And they're going to help me mix it the first time. But you know what I'm going to do though? I want to just see if I'm super confident that I can mix it myself. I'm kind of looking around because I have my windows down a little bit. It's really stuffy in here. I don't have my heat on or anything, but gosh, do I? It usually says climb it off. No, it's not on. Okay, anyway, yeah, I want to try and mix it myself and just ask her if I can do that because I know what to do. This is a 10 milligram. This is a 10 milligram vial. So I'm gonna have to fill this up to 100 with the bacteriostatic water and put it inside of that vial. And that's all you do to mix it. There's a little bit more to it than that because first, this is gonna have a vacuum inside of it. So first I'm gonna have to suck out a bunch of air, like as much as I can. And then I'll put the air back into this and draw up the full vial of bacteriostatic water, and put it inside of that. And my only concern was, will it all fit in there? But I'm pretty sure it will. Yeah, I'm pretty sure it will. If it doesn't, well then I'm just gonna have to go home and do it because I didn't bring my sterile vial, and I do have an empty sterile vial at home. Unless they have one in here. So, okay. Well, I guess I'm gonna head in there and see if she's ready for me. I'm about 10 minutes early, so yeah. Okay. And I assumed that I was going to be doing the injection while I'm here. I'm assuming they're going to want me to do the injection in front of them the first time. I don't know for sure. If not, I'd rather do it later, like closer to bedtime. But just in case, I've been hydrating. I've already been drinking. I have a different bottle of water too, but I grabbed one because, like I said, I went to Costco, so I grabbed one in there. I've drank a little bit of that, and I got rotisserie chicken at Costco, and I literally put on a glove and went back there and yanked off a piece of that chicken and ate it on my way over here. So because I've heard that it's a good idea. Everything that I've read says it's a good idea to eat a little something before your very first injection. So maybe before all your injections, I don't know. Before your injection anyway. So that's what I did. And yeah, it could cut down on possible side effects like nausea. And I don't really want that, so yeah. Okay, well, I'm gonna head on in and see what happens. See if she'll let me mix it myself in front of her. I'll tell her what I'm gonna do before I do it. Yeah. That way, I mean, I'm very confident, but maybe I'm mistaken, you know? So, okay, I'm heading in. Okay, all done with the appointment. She just wanted to mix it to show me. So I did not mix it myself. And I was, well, I would have been right, except for, I thought my dose was going to be different. They're having me do half of the dose that I thought I was going to start with. So that's fine. But anyway, I'm just doing a really small dose. It's like half of the beginner dose. But it's hard to see those lines. Like on the syringe, it's easier to see. Okay, so it's easier to see the 25 than it is to see the 15 on the syringe. So she actually mixed with 2 full syringes of the bacteriostatic water, which is fine, but you know what? I'm going to run out of bacteriostatic water sooner than I thought, doing it that way. But whatever. But then she said too, I'm supposed to do it every 5 days, which I was just going to do it once a week on the same day each week, just once a week. But he has people do it every 5 days with the smaller dose to start with. So, okay, all right. And she said I shouldn't feel side effects, but I might feel a little wave of nausea here and there. And she just, she just said, and I already knew, you eat the protein, make sure you're getting the fiber, the water, lots of water. So, yeah. Anyway, oh, and did I tell you, she did give me the injection? Which I was just going to do it myself, but she just put it in my arm. I did it right somewhere in here. And yeah, so, and I got my appointment made for next week. I come back for the follow-up for my blood work that was last week, as well as the ultrasound results, which they don't have yet, but they'll have them by next week. So she's actually calling the hospital right now. She was calling the hospital as I was leaving the office. So yeah, just to make sure they're sending them the results. Okay, so next will be results. Yep, so don't go away. Just got to my doctor's appointment to get my results from blood work that I had a couple weeks ago and the ultrasound that I had last week. So it's a new day. It's a new week. Went to Costco right beforehand, so I only have like 4 minutes to spare before my appointment time, but that's okay. Yeah, I'm not doing a haul today, so you can see I got bath tissue, I got Ritz crackers, and I got some Downy beads, and that's it. So, yep, 2 things of Downy beads. Okay, I'll be back. I'll be back. So I didn't even give you an update after the doctor's appointment, like while I was still there, because honestly, he didn't tell me that much. He said, I'm not a gynecologist, and I don't pretend to be. So that's the reason he sends me to one. But anyway, let me be honest, ChatGPT told me more than my doctor did, more detail. So that's what I'm going to read from here. And that is why I'm sitting here in the living room, because I cast my computer screen to the TV. So I'm sitting here looking at that. So I can my printer's not working, or I just would have printed this stuff out and read it from the paper, but my printer's just not working anymore. So anyway, the results from the ultrasound. The blood work didn't show anything that needs talked about. So the blood work's fine. Nothing's going on there. But the ultrasound, so I'm trying to get to the part where, okay, here it is. I'm using my trackpad out here, and there's a major lag using it on the TV. So it's kind of jumping all over the place. But I'll do my best here. Bear with me for just a few minutes here. Okay, so here's what I said to ChatGPT. Can you help me understand what all of this means for my tests? I had an ultrasound for postmenopausal bleeding. Real-time sonogram of the pelvis was performed with color flow Doppler. I'm just reading everything that it said, because I'm just open book here. Open book. So the uterus is anteverted, which means it's tilted. It's enlarged, containing multiple fibroids. The largest is seen posteriorly? Yeah. And is I'm just going to skip some of these words. I don't even know how to pronounce them. But it's significant in size. Okay, there's a fibroid indenting the posterior aspect of the endometrium. Bladder is unremarkable. No free pelvic fluid. I checked ovaries. And everything seemed fine there. Okay. I'm not going to read all the stuff that I typed in because I typed it straight off of the result, the paper that had the result on it. And I had to type it all in, every bit of it, because that particular thing, it's a PDF, it won't let me copy and paste. So I was like, oh man, I'm going to have to type all this in. Okay, so anyway, I just typed everything in and asked it what help me understand this. So what your ultrasound is describing is an enlarged uterus with fibroids, and overall it doesn't sound like they saw an obvious cancerous mass on the scan. Here's a plain language breakdown of each part. The uterus is anteverted, just means your uterus tilts forward. It's a very common and normal position. It's not normal though, so it really isn't. But anyway, it is enlarged, containing multiple fibroids. Fibroids are non-cancerous growths made of muscle tissue in the uterus. They are extremely common, especially in women in their 40s and 50s. An enlarged fibroid uterus means fibroids have made the uterus bigger than average. The largest is seen posteriorly and is heterogeneous, measuring 5.8 centimeters. That's big. Okay, that means it's towards the back side of the uterus, and it's a little over 2 inches. Heterogeneous means it has mixed texture appearance inside, which is very common in fibroids because they can have degeneration, calcification, or different tissue density. Okay, color Doppler looks at blood flow. So the part where it says there is no significant internal color Doppler. The statement generally means the large fibroid is not showing unusually high blood flow, which is usually reassuring. And I'm just kind of skipping over the parts that I don't really necessarily need to read, I guess. Okay, the endometrium is the lining inside the uterus. That's where the smaller fibroid is, and it's pushing into or pressing on that lining. Fibroids that affect the lining can sometimes cause bleeding, spotting, cramping, pressure symptoms. I had it all. All of those. All of the above. Yes, I did. Okay, even though you are postmenopausal, this could potentially explain bleeding. There is no discrete endometrial mass. This is reassuring. They did not see a clear mass or tumor in the uterine lining. So that's reassuring. Endometrium is grossly unremarkable. That means it looked generally normal. Okay. I am putting some cuts in here because I'm pausing while I'm reading stuff that maybe I don't need to read every single word of this, honestly. Okay, it also says there is no free pelvic fluid, usually reassuring. They did not see abnormal fluid collecting in the pelvis. Okay, left ovary is normal. Right ovary could not be visualized. Very common after menopause. By itself, this statement is usually not alarming. Okay, the overall impression. I guess I could have just read you this part, couldn't I? Now you tell me. Now you think of it. The main finding is multiple uterine fibroids, one fairly large at 5.8 centimeters, one smaller fibroid pressing into the uterine lining. And what this report does not mention is a suspicious uterine mass, obvious ovarian mass, or abnormal pelvic fluid. And those are reassuring points. Okay. And this other stuff might just be blah, blah, blah stuff. I think it kind of is. Okay, your doctor may still recommend an endometrial biopsy, which I'm having next week. A hysteroscopy, repeat imaging, or monitoring the fibroids. I don't want to repeat that ultrasound again. No. Yeah. So many times this is done simply to be thorough. Well, I'm having the biopsy next week, so. Train. Treatment options for postmenopausal bleeding with fibroids usually depend on how much bleeding you have, whether the bleeding keeps happening, the size and location of the fibroids, whether the biopsy results are normal, pain or pressure, age, and overall health. So I'm not going to know any of that stuff until after next week, and maybe even further than that. The endometrial biopsy. This is not really a treatment, but it is commonly the next step for postmenopausal bleeding. A small sample of the uterine lining is taken to check for abnormal cells, precancer, or cancer. Even when the ultrasound looks reassuring, many gynecologists still recommend biopsy after menopause to be safe. So, yeah. Medications are used less often after menopause than before. Yeah, probably because you're not planning on having kids again. You know what I mean? After menopause. That's my assumption. It doesn't say that, but makes sense. Pain control, yeah, the usual Tylenol, Advil. It just goes through the other things that I'm not having done, at least as of right now. So I'm not going to read any of that, like the hysterectomy, hysterectomy and stuff like that, which may actually happen whether there's cancer there or not, because the fibroids can become cancerous. So yeah, it looks like the rest of it's just kind of repeating what I've already said, basically. So can you hear the snoring at all? It's not snoring real loud, but we got Winston laying here next to me. Okay, but that's the whole basically overview of my test results from the ultrasound. I'm not going to know anything else until after next week, and probably however many days after that, when they actually get the results and get back with me with the results. So I'm going to go ahead and end this video now, and I will come back again with a different video to go into the results of that. So, okay. And like I said, my blood work didn't really show anything. He does want me to start back on some DHEA because the blood work did show low DHEA level. And I don't know if I want to, because I don't know. It's in my head now that that's what caused the bleeding, but obviously it isn't. So, but he does want me to start on a lower dose of it and do it just like 3 days a week, my choice what days. He said like Monday, Wednesday, Friday, whatever. So I guess I'll try it again and see what happens. But I guess it's just a coincidence that that's when all the symptoms started, when I started taking the DHEA last time, because obviously there is something going on. Winston, come here. Come here. Come here. Come here. Come here, buddy. You want to come up here and make a little appearance real quick and say hi to everybody? I haven't seen you in a while. You gonna give me kisses? Aw. Yeah, so this little guy though, he hangs out. You're stinky. You need a bath, man. You kind of stink a little. You smell like a dog. Papa John said he was gonna give you a bath over the weekend. He didn't do it, did he? You stinky. He's not stinking bad. I can just smell him when I put my face right up on him. Oh. Yeah, I think some of it's your breath. Okay. So I just thought I'd let you say hi to Winston real quick. He's going to give me kissies. All right. Yep, that's going to be it for this health update. And I will see you in the next one. Winston, look at the camera. Look at the camera. I'm trying to get one. Wait, stay here. Don't start freaking out. You'll look like a dummy in the picture. Oh, you want to bark because there's people outside.
What are you doing?
Yeah, that was a good one.